Thursday, May 7. This is the news on PBCJ. I'm Carol Francis. The communities of Dover, Enfield, and Onoto Bay in the parish of St. Mary have been placed under quarantine for 14 days, with effect this morning, Thursday, May 7 to Thursday, May 21 at 6 in the morning. 13 people have tested positive for COVID-19 in the communities. There is reportedly considerable movement of the affected persons, which has increased the risk of exposure to all persons in the communities. The Ministry of Health and Wellness says exposed persons in the communities may develop infection and cause spread to other members, resulting in a rapid increase in the number of positive cases. This is due to the high movement of persons within the affected households within the communities, the high population density of two of the communities identified, and the high vulnerability of persons within the communities to severe illness due to age and other socioeconomic factors. The quarantine of the communities is to restrict movement of members of the communities to slow or prevent new exposures. The World Health Organization, WHO, wants countries to address shortfalls in their healthcare systems to fight the next pandemic rather than scrambling around in a panic when it hits. This warning came from the latest WHO press conference. Simone Absalom reports.
WHO Chief Tedros Ghebreyesus says investing now would save lives later as the death toll from COVID-19 surged past 250,000.
The pandemic has highlighted the importance of strong national and subnational health systems at the foundation of global health security and universal health coverage. Strong and resilient health systems are the best defense not only against outbreaks and pandemics, but also against the multiple health threats that people around the world face every day. And yet, on current trends, more than 5 billion people will lack access to essential health services by 2030, including the ability to see a health worker, access to essential medicines, and running water in hospitals.
Tedros says the world spends around $7.5 trillion on health each year, almost 10% of global gross domestic product. But investing in preparation for emerging pathogens had been ignored for far too long. He says not only was prevention better than cure, it's also proven cheaper in the long run.
Prevention is not only better than cure, it's cheaper and the smartest thing to do. The COVID-19 pandemic will eventually recede, but there can be no going back to business as usual. We cannot continue to rush to fund panic, but let preparedness go by the wayside. As we work on responding to this pandemic, we must also work harder to prepare for the next one.
The novel coronavirus has killed at least 257,000 people and infected more than 3.6 million. WHO Emergencies Director Micheal Ryan says he is particularly concerned about the virus now spreading in countries that are already suffering existing humanitarian crises, such as Yemen, Syria, and Haiti.
We believe that the virus is spreading at community level, and we need to focus on providing essential health services and COVID-19 services to all people in Yemen, as we do to all people in Syria, and working across lines and ensuring that we are getting and reaching all people within borders, regardless of the different conflicts that are ongoing, is becoming an increasing challenge for the humanitarian organizations.
Tedros says strong and resilient health systems are the key to a successful emergence from social and economic restrictions without provoking a second wave of infections. Simone Absalom, PBCJ News.
As of Thursday morning, Jamaica had recorded 478 cases of COVID-19. Health and Wellness Minister Dr. Christopher Tufton gave the update on Wednesday at a media briefing. Marlon Samuels has more in this report.
On Wednesday, the health minister updated the nation on the latest COVID-19 numbers.
The last 24 hours, we have seen 5 additional persons testing positive for COVID-19, which brings our numbers now to 478 confirmed cases on the island. One of the new cases is an 18-year-old male from St. Mary, and he is a contact of a previously confirmed case. The others are 3 men who range in ages from 18 to 69 years, and 1 woman who is a 17-year-old.
Dr. Tufton said the ministry is exploring expanded testing options for the virus, now that the backlog of pending tests has been cleared. For this, he said, the ministry will collaborate with regional health authorities. Chief Medical Officer Jacqueline Besweser Mackenzie gave a sobering report as it relates to the possibility of future cases and of community transmission of the virus.
At this point in time, after we've had several areas where we have had cases, we would have not been able to detect all the cases that would have been possible, that would have all the possible infections that would have risen out of those cases. And there are many persons who would not have shown symptoms or would have been so mildly symptomatic that they would not have considered themselves to have symptoms. But in terms of wanting to determine the level of exposure of the population, that is when we would now look at the antibody test. That would give us an idea as to whether or not the persons within those communities had an exposure to the virus. But now we're also going to be looking at targeted groups. Groups that we see have been seeing cases in and groups that we think are at risk. For example, our transportation persons or security persons. We're going to be looking at some of those groups. We're going to be guided by what is happening in our parishes, and we're going to be taking on some of those groups to do routine testing to see what is the level of the disease in these cohorts.
With a population of 2.8 million, Jamaica is one of the largest nations in the English-speaking Caribbean. Communicable diseases like COVID-19 do flourish in dense populations like ours, a reality that local health authorities are working hard to contain. For the news on PBCJ, I'm Marlon Samuels.
Last week, Permanent Secretary in the Health and Wellness Ministry, Dunstan Bryan, revealed that to date, $2.5 billion has been spent in the fight against COVID-19. On Wednesday, Portfolio Minister Dr. Christopher Tufton announced that the Auditor General Department will next week commence an audit of the funds.
A few days ago, I think last week it was, the ministry published the numbers as it relates to how resources have been allocated and spent on the COVID-19 response. And I'd like to announce that the Auditor General has expressed an interest in auditing those numbers, or the ministry, as it relates to COVID-19 expenditure. Of course, we have no issues with that. I think that's important for transparency and accountability. And that audit will commence, I am told, sometime next week.
Dr. Tufton says the ministry welcomes the audit.
The executive management of the ministry welcomes the audit as a tool for effective and efficient implementation of activities and for transparency and accountability. And the public will, of course, be provided with any detailed outcome. Of course, the Auditor General has a process that leads to that kind of expose. So just to note that for the public's understanding.
As of Thursday morning, 57 Jamaicans have recovered from the COVID-19 virus.
We continue to see patients with COVID recovering at an increasing rate, and that's a very positive development that I think Jamaicans would want to understand and continue to be updated on. So we have in the last 48 hours had 8 more persons recovered from COVID-19, the procedure being 2 negative tests within a 48-hour period, having had an initial positive test. The total number of recoveries are 57, and we continue to monitor the others. For the most part, these individuals are showing very good signs of recovery.
Another bit of encouragement: of the 412 active cases of COVID-19 on the island, none are considered critical. At Wednesday COVID-19 Conversations virtual meeting at the ministry's New Kingston office, Minister Dr. Christopher Tufton spoke with a patient who has recently recovered from the virus.
Do you know how you became positive? Is it that you got it from someone, or you brought it in, you were traveling, what?
No, I was just in a vehicle with someone, you know.
Okay.
I didn't know that the person was sick or anything.
Right, that's important to know, which means, you know, you could pretty much pick it up anywhere, right? You were just a citizen going about your own business.
Yes, sir.
And then how long did you spend in the hospital?
I spent 1 week in the hospital.
Okay.
But I was quarantined for 3 weeks at home before I was tested. Doctors and nurses are very good, and there's a particular doctor that will come on and talk to us. I wish not to disclose his name on the here. And the patients, some of the patients, you know, they will get frustrated because if you're in there and you're not getting your test result and it's taking a little longer time, or you're feeling, you know, people will feel depressed at times. Really depressed because you're not going out, you have your business to go and do, bills to pay, and you understand, nobody can see you, you're isolated, so it takes a little while.
It is a challenge, and when you're not used to that and you're a hardworking individual and you have children to take care of and home and so on, then you can fully appreciate. I think every Jamaican can relate.
I would like you to raise an aware campaign for this stigma, because it's another thing, just like how you have the dengue virus and all of those, so that people can be aware that it is not a death threat. Because some people will get sick more than some because of the underlying problem that they have, and some immune system are stronger than some.
The Boeing 787 aircraft that brought home 115 Jamaicans who were stranded in the United Kingdom is scheduled to leave Kingston today, May 7, with scores of British nationals who have been stranded on the island for weeks because of the closure of the border in response to the COVID pandemic. The Jamaicans who arrived on the flight on Wednesday include crew members of the Marella Discovery 2 cruise ship who a month ago came close to home but were unable to set foot on local soil. Foreign Affairs Minister Kamina Johnson-Smith was at the airport to greet the Jamaicans. The Jamaicans are now being quarantined for 14 days at a North Coast hotel before they are allowed to go home. National Water Commission customers with overdue balances of more than 90 days will benefit from a 30% discount. NWC President Mark Barnett says the discount is aimed at ensuring that customers are not denied access to potable water due to financial constraints amid the outbreak of the coronavirus COVID-19. Mr. Barnett says the NWC has also waived the reconnection fee for customers who were disconnected prior to the first confirmed case of COVID-19 in Jamaica. Mr. Barnett says more than 31,000 residential customers will benefit from the waiver of the fees. The discount began on Wednesday and will end on July 31. Veteran photojournalist and former head of the Jamaica Observer's photo department, Micheal Gordon, is dead. Mr. Gordon previously worked at the Jamaica Information Service before joining the Observer at its inception in 1993. He has received several awards for his news and sports photography, including an Order of Distinction. This week on Culinary Trails, we continue to look at the safety protocols restaurants have put in place due to the COVID-19 crisis.
This week on Culinary Trails, we continue our talk with Chairman of Subway Jamaica Limited, Mr. Donovan Walker, on his company's response to the COVID-19 pandemic.
We want to first of all say to our customers, thank you for your support during this difficult time. We have had some very loyal customers. And of course, as importantly, thanking our Subway team who have come out and they have operated in the way that we expect them to do. And we're very, very happy that with the way that our team has operated.
Mr. Walker says Subway International's response to COVID-19 has been formulated as a team effort.
So Subway has 40-something thousand stores worldwide and a massive team and infrastructure to support that. So there really are three broad areas that we're focused on. To have uniformity of health and safety standards throughout the entire globe. And where those can't be met, the one assurance we have, if we sense a problem, we would prefer to close our store temporarily and than to try and serve the public. So the first thing is to maintain global uniform standards. The second thing is that an integral part of our organization in Subway Jamaica is our team. We have some wonderful team members, many who have been with us for over 20 years. And so their health and safety is important to us. Them getting home, their family's safety, because this is a highly transmittable disease. So we want to ensure that they wear masks going home, that when they go home, they continue to follow the excellent Subway hygiene standards throughout their lives. And you know what? Those who have been working for a long time, they've adapted into their own lives a culture of cleanliness and hygiene, which Subway has inculcated in our training for decades. So that's really what we're about.
In an effort to adhere to the government's protocol on social distancing and other measures implemented due to the advent of COVID-19, like many other restaurants, Subway has opted to close their dining experience and provide a takeout experience only. Some eateries have even shortened their menu, but not Subway.
The wonderful thing about our takeout menu, it exactly mirrors our menu that we have. And of course, those who want to see our menu, they can go to our Facebook page, they can go to our Instagram account, they can go to our website. But just to give you an idea, we sell lovely sandwiches. That is our base, both foot-long and 6-inch sandwiches on different types of breads. So by the time different types of meats, different types of fillings, so you end up with thousands of varieties of products. In addition to that, we have pizzas, we have salads, we have cookies, we have a great relationship with the team at Pepsi, so we serve a line of Pepsi products. We have a wonderful relationship with the team at True Juice, so we serve Jamaican-based juices as well, and we have a wonderful array of products which our customers can see on our social media pages and on our website. Recently, what I'm very excited about is our breakfast menu. We've recently introduced to the Jamaican public a coca bread sandwich using mini coca breads, those wonderful breads, and we are now serving Subway products on it particularly for breakfast.
It's no secret that COVID-19 has put a strain on the resources of the country in all sectors, especially health and security. Subway is one of several businesses in Jamaica to step up its corporate responsibility.
Yes, absolutely. And even before COVID-19, Subway prides itself on being great corporate citizens. Immediately, during the COVID-19 crisis, we really have been working with our security forces, and we have been giving hundreds of sandwiches away to support whether it's the police stations from as far away as Montego Bay to Fort Moore to all over Kingston. In addition to that, the frontline heroes in this fight are our healthcare workers, and we have given some sandwiches away to healthcare professionals at the university hospital. But this doesn't only happen in Jamaica. because the spirit of corporate support and giving goes well beyond throughout Latin America and the Caribbean. I see daily other Subway owners giving away thousands of sandwiches and supporting and partnering with those who are in need. And we have worked closely with Missionaries of the Poor, for example, and downtown to give sandwiches and products to their the people that they're trying to help. Because what we recognize at Subway is that the real heroes in this fight, this war on COVID-19, the people who are the real heroes are the medical staff. They are our soldiers, the doctors and nurses who put their lives at risk. And so what we want at Subway to say to them is, God bless you, thank you, we are praying for you, we are supportive of you. I'll say some of our other fast food restaurants in Jamaica are doing the same thing, and we're seeing great contributions coming from other brands as well. So my brothers and sisters in the fast food restaurant, I big you up as well.
Mr. Walker had some advice to entrepreneurs and fellow Jamaicans.
Our struggles and fight, when we ground it in positivism and in a belief in God, and our national anthem, which is a wonderful prayer, speaks to that. So I would say to those who have had to close, treat it as temporary. We need you to bounce back. We need you to have faith that this won't last for long. You need to, in the interim, stay home, listen to your leaders, follow their social distancing protocols, sanitize, wash your hands, and not spread this thing around.
Gabriel Thompson will now bring us up to speed with news in the financial markets. Time now for the business report.
According to the latest ex-refinery costs from Petrojam, fuel prices will remain unchanged, effective Thursday, May 5. This means that 87 and 90 octane gasoline will continue being sold for $116.92 and $119.76 per liter respectively, while automotive diesel fuel will be sold for $109.40 per liter and ultra-low sulfur for $116.16 per liter. Meanwhile, kerosene will be sold for $91.89 per liter, propane liquid petroleum will be sold for $38.37 per liter, and butane liquid petroleum will be sold for $42.94 per liter. Marketing companies and retailers will add their respective markup to these prices. In Wednesday's trading session, the JSE combined index advanced by 1,983 points to close at under 400,000 units. Overall market activity resulted from trading in 76 stocks, of which 34 advanced, 29 declined, and 13 traded firm. The junior market index declined by 36 points to close at under 3,000 units. Stocks advanced for 1834 Investments, Burrito Investments, and Berger Paints Jamaica. Stocks declined for Access Financial Services Limited, Blue Power Group, and Siboney Group Limited. Trading firm were AMG Packaging and Paper Company, Carreras Limited, and Epley Limited preference shares. Wigton Wind Farm Limited ordinary shares was the volume leader with over 5 million units, followed by Trans-Jamaican Highway Limited with 4.6 million units, and Proven Investments Limited US dollar with over 1 million units. Now for the foreign exchange. The US dollar on Wednesday, May 6 ended trading at $145.08. The Canadian dollar sold for an average $103.56. The pound sterling traded for $181.47, and the euro ended trading at $159.86. Oil dropped 4% to below $30 a barrel on Wednesday as U.S. crude stockpiles ticked up and diesel inventories swelled, offsetting OPEC-led cuts in production and hopes for a recovery in demand as some countries ease coronavirus lockdowns. Brent crude futures dipped $1.25 to $29.72 a barrel. West Texas Intermediate crude futures fell 57 cents to $23.99 a barrel. That's it for the business report on PBCJ. I'm Gabrielle Thompson.
In regional news, we begin in Guyana, where the national recount of the March 2 general elections began on Wednesday. The details from InfoHub.
The national recount of the March 2nd, 2020 general and regional elections here in Ghana got underway earlier today at the Audit Conference Center just behind me. But before the actual recount started, there were some delays, as we heard from Minister of Public Infrastructure, David Patterson.
First thing that I observed is that they relocated. We initially, when I was here, I think it was Saturday, we had the particular booths and areas were allocated for different districts. When we went there this morning, they've changed that around, and they also increased marginally some of the amount of persons that can be in each booth. The problem that happened is that apparently the PPPs could not find the keys to for their chains, so they just finished cutting the locks, the PPP locks off of it. I hope that doesn't cause any controversy, but everyone was there, and I think I saw the PPP agents. They themselves gave someone the bolt cutter to cut for that.
Later on, we were given a briefing by Public Relations Officer of the Ghana Elections Commission, Yolanda Ward, who told us exactly what took place this morning.
Got off to a bit of a late start this morning. Of course, with the security system that is in place, ensuring that every person, every vehicle who enters the Audit Conference Center, that they go through a detailed security check. And of course, as you know, this is based on our experience, as happened at the Ashman's building during that period. We also had a delay where a party could not locate their keys for the containers. Eventually, we had to, with the permission of the party, use the cutter to cut those chains. We also had a situation where there were 2 unknown chains on a container. I think it's from the Region 3 container. No party owned those locks and chains that were on the container, and so we also had to resort to cutting that. Also, I should let you know that in one of the containers that we opened, I think it has ballots from Region 1. What we found was that one of the ballot boxes was filled with water. What happened there is that upon inspection, we found that the container it was stored in, there was a hole right where that box was stored, and apparently from the rain and so on, water would have gotten into that particular box. It's just one box. We are making arrangements to ensure that that is corrected, and of course it will be for the Commission to determine how we move ahead as it relates to that one specific box, which was from Region 1.
The order for the national recount was gazetted on Monday, making way for the national recount to actually take place. I am Felicia Valenzuela with the senior videographer Paul Bridgemahan from the Audit Conference Center.
Over in the Bahamas, plans are advanced to assist nationals who are currently stranded in the United States. We have the details in this ZNS report.
Authorities in Florida are working around the clock to return Bahamians stranded in the United States home. Consul General in Miami, Linda Trico-Mackey, says the office is finalizing plans and the first group of 190 Bahamians should be home by Friday. We're told that there are 3 flights, 2 of them set for the capital and 1 for Grand Bahama. In a statement issued by the Ministry of Foreign Affairs, officials say the immediate focus was to organize the return of those in Florida, more specifically West Palm Beach and Miami in the first phase. They stressed that only those who have tested negative for COVID-19 and have agreed to adhere to the strict regime regime determined by the Ministry of Health will be transported. According to the statement, government facilities will be provided for quarantine when that determination is made by the Ministry of Health, and although they tested negative for the virus, protocols have been put in place to ensure that anti-COVID-19 spreading measures are practiced during travel. Well, as we've said, the first group will travel on Friday, and Bahamian citizens and residents in jurisdictions outside South Florida should be reminded that the repatriation exercises will be done in a phased and orderly manner depending on registration data received from the embassies and consulates abroad. Going forward, the ministry will create a new web page which will support the online repatriation registration process. This will allow Bahamians overseas as a result of COVID-19 travel restrictions to expedite the application process. Now, the public is encouraged to visit the Ministry of Foreign Affairs website, www.mofa.gov.bs, for important notices and updates regarding this ongoing exercise.
Trinidad and Tobago's Police Commissioner Gary Griffith is calling for politicians to desist from making wild allegations as it results in a waste of both the police's time and resources. The call comes on the heels of the announcement that 2 high-profile matters have now been closed by the police as investigations have resulted in little or no findings. TTT's Crystal Wilson tells us more.
2 high-profile matters have cost the state millions of dollars in investigations, and in the end, all for nothing. The case is one involving nefarious bank transactions made to a Miami-based bank, and the other, the Cambridge Analytica issue, in which it is alleged that the opposition UNC was involved in breaching the privacy of citizens with the intention to manipulate this country's electoral process. But according to Police Commissioner Gary Griffith, following intense investigations, those matters are now closed.
This is what we have to go through in Trinidad and Tobago Police Service. Somebody goes on a political platform and makes an accusation, and we have absolutely nothing to show that this took place. And then a man with an orange head decides to write a book, and this becomes news and gossip. And the police now, we have to utilize all of our resources to try to ascertain whether it is true or not.
In October 2018, Prime Minister Dr. Keith Rowley refuted claims made by opposition MP Dr. Rudal Munilal during a parliament session that a cheque was paid to the wife of a high-ranking government official. Police wasted no time and investigated the claims. This is what was found.
So, having regards to the fact that there are no transactions, there are nothing to connect the parties who were listed in that contributions together. I have spoken to the Commissioner, and he's of the view that pending any further information or any new information, it is the directions of the Commissioner of Police that these matters be closed.
Meanwhile, in 2019, National Security Minister Stuart Young officially requested that investigations be launched into allegations made by author and former Cambridge Analytica employee Christopher Wiley that the UNC was involved in breaching the privacy of citizens. But Deputy Commissioner of Police Jason Ford says attempts to gain information proved difficult at every turn.
The team, which is the investigative team, had no responses from these persons and organizations that we had reached out to. In light of that, can say we are stumped. And as such, the Trinidad and Tobago Police Service is closing this investigation pending the emergence of evidence to support the investigation.
Commissioner Griffith maintains the Trinidad and Tobago Police Service is an independent body and all decisions made are not influenced by members of the public. Crystal Wilson, TTT News.
In sports, we kick off with football. Don't rush the decision. That's the word from Portmore United's captain Rosario Harriot in regards to the Premier League Clubs Association's ongoing discussion on whether or not to call off this season of the Red Stripe Premier League because of the COVID-19 pandemic. The league was stopped indefinitely in mid-March when the first case of the virus was detected in Jamaica, with the intention of resuming later in the year. However, that decision has since been challenged by some who say that the uncertainty of when the virus will become less of a threat to society means that the league should just be ended and preparations made for the next season. The German league Bundesliga is slated to resume on May 15. This was confirmed on Wednesday after Chancellor Angela Merkel and state leaders gave the green light to restart behind closed doors following weeks of shutdown imposed to control the spread of the novel coronavirus. Bayern Munich and German captain Manuel Neuer says the players now had an enormous responsibility to be role models and follow the hygiene guidelines. And that's our package. Join us again tomorrow, same time, same place, for more news and sports right here on PBCJ, the People's Station.